And then protocols for employees on official or business trip or deployment outside our offices, protocols when conducting field works, sick leave arrangements. In the event that an employee is suspected as having COVID-19, the contamination of the workplace, and the joint guidelines on the isolation room usage procedure. All right, so saan nag-uumpisa yung general hygiene? Very common, okay? Washing of hands. So how do you wash your hands? Some of us are just gasan lang, binabasa lang ng water. Hindi tayo gumagamit ng soap or anything na makakatanggal ng mga dumi sa kamay natin. And then according to Department of Health, yung 20-second hand washing rule. So dapat hugasan natin ng maayos. And then coughing and sneezing. Especially dun sa may mga kasamahan tayo sa trabaho na mayroong mga allergies. Better na we follow yung tinatawag nating coughing and sneezing etiquette. So you cover your nose, if you have a tissue or hanky, and then you use your elbow kung wala naman, and then you dispose your tissue properly, and then wash your hands. And then avoid touching your face, no, particularly your eyes, nose, to prevent infection. Next is yung ating mga parcels or yung delivery natin ng mga items. Before receiving the delivery or the package, you need to secure na safe yung package. If there's a need to disinfect, better to disinfect. And some couriers nowadays, they also practice yung contactless delivery or receiving of the packages. Like instead of signing the document that you receive, they'll just take a picture of you just to make sure that you receive or an evidence that you receive the document. Avoid contact with people who are sick. Okay, so you make sure na especially kung may mga loved ones tayo, relatives na may sakit, not necessarily COVID. Kasi sa panahon kasi ngayon, if may sakit tayo, kahit simpleng fever, simpleng colds or cough, that is already a sign na medyo bumababa yung ating immune system. So pag bumaba yung immune system natin, possible na maging prone tayo sa COVID-19. And then the wearing of PPEs natin for RD Corporation, since sa nature ng ating business, we only require face shield tsaka yung face mask. Now, if we're going to, let's say, meron tayong gagawin na disinfection, that's a time gamit tayo ng gloves, especially if nagmi-mix tayo ng mga chemicals. Now, disinfection protocols. When we say disinfection, this is a process of cleaning using the appropriate disinfectants. So what are those disinfectants? We can make use of the Lysol or Clorox. I-mix lang natin with water. So those are just examples. You need to be careful, no, when using those chemicals kasi those can be harmful sa health din natin pag na-absorb or na-inhale. Now, assigned personnel shall wear the appropriate disposable PPEs, so face mask and gloves, and wash hands with soap and water after doing the disinfection. If soap and water are not available, alcohol-based hand sanitizers and alcohol. However, if your hands are visibly dirty, you need to wash it with water talaga. So all work areas and frequently handled objects such as doorknobs, handles, yung mga equipment natin, like for example, the photocopier, the mineral water dispensers, yung doorknobs ng CR, what else? Yung laptop, yung lahat na frequently nahahawakan natin, especially yung mga hindi lang ikaw yung gumagamit. Like for example, also yung ating biometric. So dapat ma-disinfect siya every 2 hours. Now for electronics, kagaya ng cellphone, keyboards, computers, and yung may mga remote controls tayo, be careful of using the chemicals kasi baka masira yung material. So disinfection of service vehicle every after use. So para matanggal yung mga mikrobyo. And then gagamit din ng PPEs. Ito, very ano na to sa atin, parang nakasanayan na natin, ginagawa natin every day and wherever we go. Wherever we go here in the city, we visit other places, even outside Jensen. So this is a requirement to everyone, which is temperature checking. So if the temperature is above 37.5 degrees, doon na tayo hindi pwedeng pumasok sa establishment or sa workplace natin. Other option is mag-rest ka ng mga 5 minutes. Okay, rest ka ng 5 minutes and then after that, take ka ulit ng temperature because there's a possibility that you were exposed outside. Perhaps medyo malamig yung aircon or let's say masyado kang exposed sa init. So may ano yan, may epekto dun sa temperature natin. However, if ever na after 5 minutes mataas pa rin yung iyong temperature, you will be rejected to, enter the workplace. So you need to inform your immediate superior if there's a need for you to arrange a work from home schedule, and then or you will use your leave credits. Okay. And then aside from temperature checking, employees must use face mask. And especially ngayon, nire-require na rin yung face shield. So to ano lang, I would like to reiterate that the choice of face shield must not be according to fashion. Okay? It should be standard. When you say standard, the whole face is covered. Hindi pwede yung eye goggles lang or yung eye protection lang, hindi pwedeng half face lang. So you make sure na matibay din yung material ng face shield natin because we will be using our face shield for many months pa. Hindi lang siya for a short period of time. So possible yung ating face shield will be using that until next year, until the vaccine is available for this in the market for everyone. So hangga't wala yung vaccine natin, possible na yung face shield required pa rin siya, mandatory pa rin for everyone. And then we must fill up the health checklist. So for RD Corporation employees, we have the electronic and hard copy. Now, we're using the hard copy for those employees who are not reporting physically in the office. This also covers the visitor and the ranch employees. And they submit it to our security guards, and then the security guards evaluate the form. If ever the visitor or the employee hindi nag-qualify dun sa requirement para makapasok sa compound, hindi sila papasukin. Let's say mataas yung kanilang temperature or meron silang mga history of travels from places na may mataas na number of positive COVID-19 cases. Aside from that, kung may mga simptomas na at least more than 2 symptoms like fever, colds, lahat ng mga flu-related na mga symptoms, hindi pwedeng pumasok sa workplace. Just a friendly reminder again to everyone, please be honest. Please be honest when we are, providing the information using our health checklist. So whatever health symptoms na meron ka, you need to declare. And if ever naman na feel mo na parang you're not feeling well, hindi ka na puwedeng pumasok. Okay, hindi na papasok sa opisina kahit na sabihin natin na marami kang mga urgent, um, deliverable na kailangang maibigay agad, the soonest, hindi puwedeng pumasok. So, part 'yan siya ng ating, code of conduct na 'pag, you are exposing ang iyong workplace or yung coworkers sa sakit, that is subject for disciplinary action. Now, let's say if the employee has 2 or more symptoms, the safety officer will collect the health checklist daily for review, and we have two ways of collecting the forms. Meron tayong electronic and we also have the hard copy. Now for the hard copy, the security guard, sila yung frontliners to first check the forms. They're going to submit the forms dito sa office for my evaluation. And then the electronic form naman, we are going to review that daily. Before lunch, tine-check natin kung sino yung may mga symptoms na kailangan nating kausapin. That may endanger the exposure of illness or anumang sakit dito sa loob ng trabaho natin. Okay, now employees who have exposure to LSI or locally stranded individuals at saka yung mga returning overseas Filipino workers, okay, must not physically report to work unless employee can present proof that they are physically fit. Example, you have your family members or relatives who came from Manila or somewhere in Luzon, and then they're going to visit you here in Jensen. So meaning to say, halimbawa, may mga employee tayo coming from Papua New Guinea, and then they traveled back here in Jensen. Before they return to work here in our compound, they need to undergo a 21-day quarantine period. Now, regarding the arrangement sa work from home or whatever arrangement na makapag-render pala sila ng work, that is an arrangement between your immediate supervisor and of course in coordination with the human resource department. Okay? So the same also with our returning OFWs. So if you have relatives or your husband or your wife or your wife is an OFW, so dapat mag-undergo the same procedure before. Kailangan ma-clear muna yung wife or husband mo and meron siyang medical certificate, swab test na negative. Now, exposure to COVID-19 patient. So, if the employees are proven to have been exposed to COVID-19 infected persons, he or she must not physically report to work unless the employee himself is cleared by authorities and such clearance is presented to and accepted by the company. For our employees who are considered high health risk, such as senior citizens and pregnant women with immunodeficiency, immunocompromised, and those with comorbidities or other health risks shall be allowed to either use their applicable leave credits to stay at home or be on work from home arrangement. So either way, the department head concerned shall recommend for approval of the work from home arrangement prior to the implementation. When you are rendering this work from home arrangement, you need to make sure that it is aligned also or coordinated with the human resource department, because whatever accident that will happen during your work hours while at home, that is considered part of the company's obligation. No? Kasi nga, you are doing that period for company. The number of hours na nandun, pasok doon sa aksidente, let's say nadulas ka. Example, you are having a Toastmaster meeting at home, and then nadulas ka. So, pagpalagay natin nagkaroon ng fracture. So your supervisor must be aware that you rendered this work from home, and then same also with the human resource department. Kasi kung hindi yan siya na-report, hindi ka magko-covered. Possible covered ka ng HMO natin, but yung tinatawag nating mga social benefits from the government, hindi mo ma. And then another one is social distancing at work. Now, social distancing is very important, especially kung medyo maliit yung room. Pag medyo maliit yung room, wala tayong choice kundi i-transfer yung ibang empleyado sa ibang room. So like for example, in our case here in CPMD, medyo malaki yung room namin. So meron kaming space, no, in between. The minimum is 1 meter. Malayo tayo, that's enough. Okay? Now, in case naman na halimbawa you're using the same table, so you make sure na alternate yan, hindi yung nakaharap kayo sa isa't isa. Kagaya na sa picture natin ngayon. So as you can see, they have a 6 feet distance away from one another, pero hindi sila directly, no, magkaharap. Mayroon space in between na alternating sila. Okay? Another one is no loitering. So loitering, yung chismisan, nag-uumpukan, okay, iwasan natin yan. Okay, so holding of activities which will entail large or mass gathering. So shall be suspended until allowed by authorities. So the use of virtual platforms and electronic or digital means for payments, collections, compliance with statutory and regulatory reportorial, communications and reporting, recruitment, hiring interviews. So lahat ng mga activities that we normally do before face-to-face. Nowadays, we are discouraging all this, face-to-face. As much as possible, you make use of our virtual platforms. Example, for the accounting department, if we have clients who are going to collect, or may mga payments na kailangang bayaran, perhaps you can make use of the online banking. Basta importante walang face-to-face na transaction. Okay, so lahat naman halos ngayon nagpa-practice ng virtual meetings, virtual transactions. So hopefully walang issue masyado dito. Okay, so for our visitors, you need to inform your visitors that it is mandatory that they need to submit themselves for temperature checking, daily health checklist, disinfection, foot bath, wheel bath, and dun lang sila sa receiving area maghihintay. Okay, protocols for employees on official or business trip deployment outside of base. So, domestic and international official or business trip to from subsidiary companies outside the country or to from identified COVID-19 high-risk areas is allowed by law to travel or return to base but required to undergo dati 14, ngayon 21 days quarantine period. And then you make sure after the quarantine period, you provide the result of your swab testing. Right? If the employee has traveled voluntarily to a high-risk country or city with increased COVID-19 cases, he or she must comply with the applicable requirements of the law before going back to work. He or she will also be asked not to come into physical contact with any coworker. So kailangan meron din siyang document na mapakita sa atin na she's fit to work. Okay, so for our service vehicles, before tayo papasok doon sa van, meron tayong thermal scanning. Meron din tayong hand disinfection, and then physical and social distancing. No unnecessary conversation inside the van. Kung kinakailangan mag-usap, you wear your face mask and your face shield. and you wear it properly. Hindi na nakalagay sa leeg or kung saan man. Dapat naka-properly intact sa face and mouth natin. And then you submit electronically service vehicle tracker. So meron na tayong tracker for every service vehicles. Now, if employees' nature of work is outside the office, yung field works, like for example, yung mga auditors, the IT, and yung mga escorts, okay, so he or she must wear the required PPEs. So, depende din sa area na pupuntahan niya. Kung high risk yung area, that requires a more higher level ng PPEs. No? Like for example, kung kinakailangan mo magsuot ng hazmat kasi or yung lab gown or just to cover the whole body, kung talagang required yung gagawin mong trabaho, then you are going to wear those PPEs. Now, if the location only requires minimal PPEs, like for example, yung ating face mask and face shield, then you follow. Of course, including the disinfection and other safety protocols. Now, if the employee needs to report in the office, let's say he or she came from the subsidiary, let's say half day nag-conduct ng audit doon si auditor, and kailangan niya bumalik sa compound dito sa. So before going back to office, of course, kailangan niyang mag-undergo dun sa ating protocols. Thermal scanning, disinfection, yung health checklist, and then yung foot bath. Kung mayroon siyang access dun sa electronic health checklist, then comply tayo sa checklist. Yung checklist natin, hindi yan siya isang beses lang natin gagawin. Every time papasok tayo sa compound, I'm sure yung iba nakakalimutan na. Let's say pumasok tayo sa office and then may errands tayo outside. Pagbalik, nakakalimutan na natin. Hindi na tayo nagsusulat. Or minsan naman, yung mga hindi na dumadaan sa opisina in the morning and then afternoon na pumupunta, hindi na rin nag-fill up ng form. So that's a gentle reminder to everyone. Every time tayo papasok sa compound, kailangan mag-fill up tayo ng checklist. Okay, sick leave arrangement. If an employee has cold symptoms such as cough or fever or feel poorly, he or she shall notify her immediate superior. And then mag-file siya ng sick leave. Kung ubos na yung sick leave, pwedeng gumamit na kung ano man yung available na leave or leave without pay. Basta kung ano man yung mga leave credits na kailangan mong gamitin, you need to inform your immediate supervisor. If the employee shall seek medical advice from his or doctor, kailangan niya mag-undergo ng COVID-19 testing. Just to add, regarding the testing of COVID-19, the HMO, yung ating MaxiCare, hindi covered ni MaxiCare yung COVID-19 testing kapag walang endorsement from the doctor. So, meaning to say, kung halimbawa, gagawin mo siyang reason ang testing because you need to secure a medical certificate, pwede kang mag-undergo ng testing. However, hindi siya covered ng HMO. Personal mong babayaran ang testing. From home. So, initially, na-discuss ko siya kanina. If an employee is ill but able to work, he or she can request to work from home together with his immediate superior. So, she would clearly define and agreed his deliverables. So, at the end of the day, kailangan mayroong outcome, yung kanyang nirender na work from home. Work from home arrangement is also applicable for other situations and reasons such as but not limited to. If an employee is a parent and needs to stay at home with their minor children during the pandemic. Ito, worst case scenario, hindi siya pwede gawing ano din. May mga maliliit akong anak. So, pwede pala akong mag-work from home. So, this is subject for approval ng iyong immediate superior. If an employee needs to provide care to a family member infected with COVID-19. Another one is if an employee belongs to the high-risk health group defined by law, and if the reporting to work physically is not permitted by law or is risky to the employee and his co-workers at the workplace. So these are some of the considerations para ma-avail natin ng work from home arrangements. In the event that an employee is suspected as having COVID-19, immediately proceed to the designated isolation area. So saan ba located yung ating isolation area? Here in the compound. If you're familiar with the RD Fishing Gate, meron tayong employees entrance doon sa gate. Si RD Fishing din merong second gate dito sa may compound malapit sa covered court. Yung isolation room is located on the left side of the gate. So kung papasok tayo sa gate, nasa left side, malapit sa guard's house. So meron tayong room doon, small room. It's a very simple room, ventilated room. Whenever needed, dahil sa meron tayong mga kailangan gawing further medical assessment, doon dadalhin si employee. And then wear appropriate PPEs. So HMO benefit and PhilHealth coverage can be used by the employee to cover the medical expenses, and then you can make use of your leave credits, but you have to coordinate with your immediate superior. And then contact tracing within the workplace and return to work documents, andyan yung mga medical certificate. The return to work checklist questions that we need to consider before an organization or a company mag-resume ng operations. So these are the questions na kailangan nating i-consider. Number one is the urgency to continue or stop the operation. Most of us are aware that there are already companies na hindi na talaga nag-open. Nag-close na talaga sila ng operation. Perhaps because of the nature of their business, hindi na siya tinatangkilik sa panahon ng COVID-19. So talagang wala na, wala nang return of investment. That's why they decided to stop the operation. Another question is the workforce required. So there are some industries that undergone yung mga retrenchment of employees. Meron ding mga redundancies na nangyari. And during this time, hindi na naging strict yung ating Department of Labor and Employment because they understand. That's why they also push this what we call special work arrangements. Kaya dyan papasok yung mga compressed work week schedule, and then kung ano pa yung mga reduction of time, may mga skeletal workforce. So hindi na 100%. Those are some of the considerations, yung tinatawag nating mga resumptions natin dun sa work. And then do employees ask to return to work and needed to be tested? So halimbawa, sabihin ni company o ni RD, before you go back to work, 100% mag-undergo tayo lahat ng COVID-19 testing. Kung direction yun ni RD Corporation will shoulder the costing. Pero kung halimbawa si employee is nagkasakit or bumiyahe somewhere, personal reasons, babayaran ni employee. So what steps should be taken to assess the health of the employees as to return work, procedure to deal with employees who report symptoms or those who have been exposed to a person who are infected, disinfection procedures, the required protocols and the requirements of law. Those protocols shall include PPE and other supplies. This is very important sa lahat ng mga employees because this will affect yung tinatawag nating mental health. Okay, when we say mental health, concerns like yung mga the usual health the usual concerns natin, and then dadagdagan pa ng COVID, no? So especially kung may mga small children tayo at home, and nandun yung feeling of hesitation to go back to work because the possibility of exposure dun sa COVID-19 na virus. So just to ease the worries and the complaints ng mga employees, the employers must of course assure the workers na it's safe to go back to work because we already have these safety protocols. We will provide you with the PPEs and etc. So those are the things that we need to consider. The contamination of the workplace. Assigned personnel shall wear disposable or impermeable gloves and gowns in the cleaning process, so including yung handling of trash. The contamination may also be conducted by the chosen provider. Like for example, yung fogging. But fogging is actually dinidiscourage siya ni Department of Health, pero as long na gumagamit si fogging ng required chemical na pumasa kay IATF, then pwedeng gamitin si fogging. But of course, 100% we encourage pa rin yung surface cleaning na tinatawag. So pupunasan pa rin yung surface. So workplace shall be contaminated with appropriate disinfectant. And then right after ng decontamination, pwede na bumalik sa work yung mga employees. Okay, so room usage, yung request protocols natin. So immediate head will inform the safety officer na may problema sa health ng employee. Let's say may symptoms na 2 or more. And then the safety officer will prepare the isolation room together with the documentation. And then in coordination with the company nurse, we will conduct medical assessment, and then we will coordinate also with the rural health unit. And if there's a need to contact the hospital para i-transport yung employee via ambulance, then that's a time na magko-contact tayo. Now, sanctions on violation. Okay, so we are all aware that we are doing these safety protocols because we are concerned of our health. No? Concerned tayo na pag-uwi natin ng bahay, safe tayo, and then safe din yung pamilya natin sa bahay. Same as well with our co-worker. Dapat safe tayo lahat. Yun dapat yung concern natin. That's why we are doing this safety protocols implementation. Since this is part of our culture, no, na we need to discipline our employees, so we have the following sanctions on violations. This is part of our CRR, yung code of conduct natin for the employees. As you can see here, failure to abide or comply with the safety, security, and environmental requirements and programs of the company. So that's a verbal warning, and then written warning hanggang suspension, and then dismissal. So we need to follow not because of the sanctions. We need to follow because we are concerned for everyone, and we are concerned, of course, for our own good. So I hope we understand this. So hopefully, wala akong mabigyan ng sanctions. Wala akong mabigyan ng disciplinary action because of the safety violations. Now, kung minsan, nagkakaroon ng lapses, nakakalimutang magsuot once, twice, okay lang yan siguro. Pero kung nagiging habit na natin na tinatanggal natin yung face mask natin, okay, that's the time that we will issue disciplinary actions to the employee. And then, another reminder, pag na-call yung attention natin because we are not following the safety protocols, I hope you will not feel bad because this is not a joke, okay? This is a concern for everyone, not only here in RD Corporation, not only here in Gensan, but we are talking about global concern. This is not just an implementation in our level. This is for everyone's good. So, kung na-call yung attention natin, we need to correct ourselves. Okay, so I hope we're clear with that. Okay, so before we end, I'm going to send you the quiz. Again, guys, kailangan makakuha ka ng 130 points for our quiz. That's only 5 questions. don't worry, napakasimple lang nung ating quiz. Just a short recall lang dun sa mga pinag-usapan natin. And if ever na your score is below 130, your attendance will not be counted. Once you receive the link, kindly answer the quiz. And then while waiting for the link, if there's any question, you can raise your questions now. I think that's all for now. By the way, guys, meron tayong ginagawa ngayon na workplace visitors guidelines. Yung workplace visitors guidelines natin, it's a joint guidelines between RDMI, RD Fishing, and RD Corporation. Kung paano natin i-handle yung mga bisita natin na papasok dito sa compound. Kung walang questions, good luck to your quiz, and thank you for listening, and thank you for your time. Have a nice